Hi, I'm Sharon Knight. It's good to see you again. I am sorry that I'm getting started late. We had a huge issue with Chrome, so we had to download another browser to get this going. But it's really great to see you again. I am Sharon Knight, President and CEO of Hope Communities, which is a nonprofit that's been in our community for more than 40 years, helping some of the most vulnerable people in the Denver metro area with housing, educational programs, resource navigation, and support services. A lot of what we've done over the years is also build community, trying to strengthen our neighborhoods and pull people together. And that's one reason why we are doing this show, because we know that some people are feeling a little alienated or isolated during this quarantine, and we want to be there for you. So we're late, but we're here. And just have used this Facebook Live format because there is the option of you communicating with me during the show. There's a comment or chat section at the bottom of the page. And so you can put your name in there, you can ask questions, you can see some links if we put them in there through the show. So you get an idea of the interaction and the relationship that we are trying to build. And we're doing this show to provide information to people about the virus, to share resources with you, and also just to make sure, again, that you know that we're there for you. So at any time, you can do a comment in the section there, and we will, hopefully I'll see that. I see that Gwen signed in, even though I'm late. Thank you, Gwen. And you can also send us a question or a comment or a request for service at any time at info@hopecommunities.org. And if you just want to get some information, we have an amazing website with lots of resources on it, which is at hopecommunities.org. And there's a special tab for resources specifically related to the COVID-19 pandemic. So please take a look there and see if you can get some information that you need. Now, I like to give a little bit of news every day, and today I want to just talk a little bit about some of the recent reports about the virus being more unpredictable than we ever thought, and certainly more predictable than most respiratory viruses. It is attacking the lungs, and it can also strike anywhere on your body, from your brain to your toes. And many doctors have been focusing on the inflammatory reactions that it triggers, and it can cause blood clots, and as we have heard many times, cause people to have difficulty breathing. It could begin with a few symptoms or no symptoms at all, and then days later squeeze the air right out of your lungs without any warning. And it picks mostly on the elderly, people who are weakened by other previous conditions or disease, and people who are obese. And it harms men more than women for some reason, but there's also signs that it complicates pregnancies. So some of the other symptoms that we have heard more about in the brain, there's been some strokes and neurological issues, some blood clots. The eyes, sometimes there's pink eye. The nose, the loss of smell happens, sometimes a loss of taste too, but the loss of smell often is indicative of something that's a little bit more serious in terms of the virus. The gastrointestinal system has been more vomiting and diarrhea, weakened heart, kidneys, and then skin, like what they're calling COVID toes, which is like a purple rash that looks like it comes from an attack on the blood vessels. So there's just been so many different types of characteristics, and it's just been an unusual virus. So it's important to really pay attention to anything that's out of the ordinary for you. And we have seen that children, while they are often asymptomatic or have very low level symptoms, they are often carriers. And so one of the things that doctors have started to do in recent weeks is that kids who have some sign of cold or virus, they've quarantined them as a preventive measure without actually doing the full test. And in a couple of cases that I know of, they've quarantined the parents, even if they thought that their child had a pretty typical cold. So just important to be watchful of these symptoms, even as we go into more of a safe at home modality. That doesn't mean that the virus is going away, and we really need to pay attention. Colorado has close to 1,000 deaths at this point, and so it's something to take seriously. We need to continue our social distancing, washing hands thoroughly, at least 20 seconds and frequently, and wearing masks in public. So the governor and the mayor, while they have moved to safer at home practices with limited business startup, they have continued to stress social distancing and wearing masks in public. While some businesses were getting back to a modified schedule of work, they were not allowing restaurants to be open because there's not really capacity for social distancing. And it just was not going to be something that happened right now. And yet we did have a restaurant in Castle Rock open up over the weekend for Mother's Day, which is pretty atrocious because there were lots of people in there. And irresponsible for the restaurant to open, irresponsible for the people to go to put themselves and others in danger. But I know people are frustrated and some people just want to get going. Please don't get caught up in that. I mean, we don't want to miss out. We are missing our friends, but this is a short-term measure, and acting rashly could hurt yourself now or others. We don't know. It's hard sometimes to follow the rules, but this is for our own good, and I please want you to pay attention to this. There's still a lot of people who have not been wearing masks in public. I saw a lot on the weekend. Social distancing and wearing masks, they're two tangible things that you can do to get some control in your life and to help stop the spread of the virus. So we've heard it many, many times before. We will get through this together, and it also is going to take all of us to stop the tide of this virus before any of us get through this hardship. My quote today is from J.K. Rowling through the words of Albus Dumbledore. We are only as strong as we are united, and as weak as we are divided. I think that certainly holds true with this whole concept around social distancing and wearing masks. We have to stand united on this. We just have to. So today I'm going to focus on masks. We're going to talk about the different types, how you use them, and so forth. When we hear about masks, there's usually 3 different types. So one is the N95 respirator. So it is really dense. There's a wire top on there that molds around your nose. And then there's a surgical mask, and then there are cloth masks. We're going to talk about each of them a little bit. So this N95 is a tight fitting, and actually it's really important how it fits, because if it doesn't fit properly, it is not filtering out the 95% of the small particles, which is what brings the name to it, N95. You have to have that tight seal, and the elastic bands have to be around your head. There's 2 of them that go around your head and really pull it tight. There's some of them, when you see them, have a little valve here, which is more for an exhalation valve. I didn't have one of those, but that helps with breathing and also the buildup of heat and humidity inside. So those masks, that N95, really are supposed to be for medical professionals. So the CDC, the Center for Disease Control, does not recommend other people use them. And it's got to be a good fit, and it's got to be limited in use because we want to direct as many of these as possible to our medical professionals. Now there's also a surgical mask, which looks like this. So usually it's blue on one side, white on the other. You do put this around your ears, and you want it to be over your nose and then this part underneath. This also, the surgical mask, has this wire on top, because you really, again, like the N95, you want to have the wire close to your nose because you want it to fit as tightly to your face as possible. So when you're putting on a mask like this, these masks are typically also not used for the general public. It's usually used for people who already have the illness. And so this will help the virus from getting out to others. So it's typically the cloth, which we'll talk about in a bit, are going to be for general use. The N95 is for medical professionals, and this medical mask would be for medical professionals with another mask over it, or for people who are already infected. And when you're putting on this mask, you want to wash your hands first or use the sanitizer. Put the mask on. You want to make sure it doesn't have any holes. You want to form that metal strip to your nose, and you want to loop and make sure that the elastic is pretty tight. So these medical masks are disposable. So you can't wash them. They're really for one-time use. If your mask gets damp or somehow damaged, then you want to replace it, and you want to put it specifically into the trash when you get that. So you can look at the medical masks if you need them in the drugstore, or you get them online, but you should know that there are some masks that are being sold online that are not legitimate, and they're certainly not high quality. So there's a couple of tests that you can find online to see if you're getting one of these medical masks, or surgical masks they're called, and then you want to make sure that it's legit. I mean, one of them is a water test, so you can actually put the mask like this and put water inside. Water should not leak through. You also should not be able to breathe through, for instance, and blow out a match or a candle. It should not be, the air shouldn't be strong enough to get through there. There's also a fire test that you can do if you take the layers apart, because usually there's 3 layers. So you just want to make sure, if you're counting on this kind of a mask because you have the illness and you don't want it to spread, you need to make sure it's a good quality mask. And so just sometimes if things are too good to be true, they really are not true. So we have to just pay attention to those. Now I'm going to talk some about our cloth mask, and I just want to take a second to thank the many donors who have helped us with cloth masks. I put out a request on Facebook and talked to different friends, and we've gotten a couple of hundred so far. We wanted to collect these masks to give to our residents and to our clients so that everybody had at least one, so they can go out in public in a safe way. And so special thanks to Beth Fisher, Beth Conover, Kathleen Pierce, Betsy Cochran, Tracy Stewart, Jolyn Snyder, and our first donor of masks, Pam Kling. It's there's lots of different varieties of masks. So we've got the pleated mask with the elastic bands. There's some pleated masks with ties that you can use to tighten around your face. We've gotten some that are shaped more like this with the nose with elastic band, and this has, again, a very nice wire. When I did the show on masks, I said you can actually use a paper clip, or you could use a pipe cleaner, something like that. That is metal. So there's lots of different options. We've recently gotten some children's masks. So, because kids, you don't want to put a mask on a child that is under 2 years, but other than that, it'd be great for them to have masks out there too, because as we just said, you know, they can be asymptomatic but still be carriers. And so if we can keep a mask on them to prevent them from passing anything on, then that would be a good thing. So important to wear the mask, but that does not mean that we don't also want to do social distancing. It's a pair. It's a 1-2 punch. We've got to social distance and have the mask. And then the third part of that, of course, is the sanitation with washing our hands frequently. So you want to wear these masks in public settings where you're going to have interaction with other people. So grocery stores, certainly, that's one of the biggest places that you might be around people, pharmacies, but even on the weekend on the paths, when you are walking on some of the hiking paths and so forth, there's a lot of people out there. So you want to use the cloth mask to protect yourself from anything getting to you. So the benefits are that you can make these out of a lot of materials, so it's not as scarce as the N95 or the medical surgical mask. They lower the risk of people without symptoms sharing those with other people out in public, and it's not perfect, but it's a lot better than not wearing anything. Don't get a false sense of security. As I said, you still need to keep the social distancing, but it's really, really helpful to have those in place. So can this actually prevent you from getting it? Well, it can prevent droplets from other people coming into contact and having you breathe them in freely. It also helps to keep us from touching our face because we're not supposed to be touching our mouth and our eyes and so forth. And so the mask kind of prohibits us from doing that, or at least it counters our capacity to do that. So there's some fabrics that are better than others. So you want a densely knit fabric as much as possible. The tighter the weave, the better. They say tea towels can be good. Things like, even like a vacuum cleaner bag could be good. A cotton fabric, t-shirts could work. An microbial pillowcase, or even a standard pillowcase, because they have a tight weave. Those things can be made into the masks. So you want to have something that is a tight weave, but that you can still breathe. So some of the first things I talked about, like the vacuum cleaner bag, that might be good, but you can't breathe very well. And if you have too much of a thick towel, it's hard to breathe. So you've got to find the right mix for you, for your level of activity, and for your security. Now, some of the masks actually have a pocket in them. So there's a pocket in there that you can place a filter in, and that just gives you an extra layer of protection. When you tie this on, you tighten it as much as possible, you pull it down, and then you have this filter that you can take in and out. So filters, you can use things like felt, which is thick, might be a little harder to breathe through that. Furnace filters, a lot of people have used those, and those are good, but you definitely need to have the cotton on either side of them, or the cloth material on either side of them, because there are tiny fibers in there that could get in your lungs. So if you're going to cut a furnace filter, you want to make sure it's really sandwiched between some other layers of cotton so that those fibers are not going to get through. There's a polypropylene shopping bag, which kind of feels like a soft fabric. It feels a little bit like this. You can see that it's foldable, but there's still a mesh. I mean, it's just that extra layer of protection. I think that whether you're using a pocket one or you're using another kind of mask that's kind of plain, that one of the things that might make people wear them more is if we customize them. So I think somebody can make a lot of money if it came up with some charms or something like that to put on masks. Remember when people were wearing Crocs and all of a sudden all the kids and people were buying little charms to put on the Crocs? Well, you could do something like this. I mean, I'm a big walker. So, this is like a walker person. This is an outward bound pin. So this is not fabulous in design, but you get the idea that it's a personalization, so that I'm saying this is who I am. So people love to dress certain ways. You like your personality to show out. So maybe something like that would make people wear them more. I don't know. So there's other things that we could use. This is not a N95, but this is something that is like a desk mask that you could get in the hardware store. It looks like the N95. It's not quite as thick. It does still have a metal top there, so you can form fit it, which would be really good to you. So you, as much as possible, you want it to be right against your face, so that you, for one thing, it won't fog up your glasses, but also it'll keep any of the particles inside the mask. There's neoprene mask that some people use for skiing. You can even use one of these net gaiters. Sometimes we use this for hiking for headbands, or you can use it like that. So there's no reason not to find something that you can use. We did a show on bandanas before, where you fold them in and then you fold them in again, and then you put plastic or rubber bands at the end. And so that's an easy way to use a bandana. And then you have a mask with rubber bands that you can put out. I'm going too fast, so it's not so neat. But anyway, you get the gist, where you just have this, so easy to make. Or you can just use a regular bandana. Just tie a regular bandana around your head, and any of those things will be so much better than not having anything at all. So you've got to have something to cover you up. So when you have one of these face masks, you want to, if you're sick, you want to still be able to be around people in your family. For instance, even in your house, if you're sick, you should have the mask on. You should have one of those medical masks on, the surgical masks, to keep the virus inside if you get to a point, because we're going to be treating most of that if you start to feel badly, like you have a flu, so you're going to isolate yourself, you're going to be taking care of yourself at home. But if you're wearing the mask and protecting yourself and then things get bad, you just have to call 911 and see what else you should do. You're going to have to continue to stay away from your family, continue to wash your hands and so forth. So just keep up the regimen for those couple of weeks that you have to be away from people. So when you are going to wear and put the mask on, any of those masks, you should be washing your hands first, and then you want to make sure there's no holes in the mask, whether it's surgical or paper, and surgical, which is paper or cloth, excuse me. And then you want to make sure that you do fit the mask right around your face. One of the things that people say, because you want it to be really firm. So one of the ideas that I saw over the weekend was for people who are out hiking, like women, instead of just putting this around your ears, you actually put it all around your ponytail. So that'll keep your mask really tight and be utilitarian while you're hiking. So you just put it around your ponytail. How do you take care of these? Actually, I just wasn't that careful when I took it off. When you're taking these off, you are supposed to take them off by the sides, and then to fold them and put them away. If you have a surgical mask you're wearing at one time, you got to put it in a plastic bag and then you throw it away. The cloth mask, you could wear it for the day, and then you've got to wash it every day. You've got to wash it. So if you could have at least a couple, that'd be really great. You should wash them in the washing machine, and then to air dry them. Part of the reason to air dry is that with the metal, sometimes it doesn't really go very great in the dryer. You also don't want them to shrink. So air dry after you wash them in hot water and detergent if you can. So if you are taking care of somebody else who has COVID-19, you should be wearing a cloth mask. They should be wearing the surgical mask. You need to keep them as separate as possible. Every time that you're interacting with those folks, you need to have gloves on, and you need to throw things away if they have any tissue or anything like that in there. Anything that you touch, even when you take them food, you want to throw the gloves away afterwards. So, and if you're handling their laundry, you want to throw those gloves away after you wear those. So you are keeping yourself as separate as possible from those folks. So they might be in a bedroom by themselves. You might have to bring food in and out or take materials out, help them to keep fluids and things like that. But you don't ever want to be touching your ears, your mouth, anything. You want to clean your hands thoroughly. You want to wear your mask and your gloves all the time, and you want to clean their surfaces around them just all the time. So got to be as vigilant as possible to make sure that we stop the spread of that disease. So the takeaways from today, and at the risk of nagging too much, I am going to say once again that it's going to take all of us to get through this and to stop the spread. So please wear a mask. There's so many cool ways that you can wear a mask. And for people who live at one of the Hope Communities properties, we have masks to give you. We've been getting these wonderful donations of masks, and so there's no reason why you shouldn't have one. And for other clients of Hope, we're happy to try to secure some masks for you. We really want to keep people healthy. So the CDC does recommend wearing these cloth masks for most of us and continuing to keep the 6 feet. So please keep doing that. Reserve those N95s for healthcare workers. So it won't protect you if you're wearing a mask. There's not a cure-all. We can't say 100% that you won't get this disease, but this thing can really make a difference. These few steps, wearing a mask, social distancing, and then washing your hands and using the sanitizer. So those are super important. We have a book review today that's going to be a lot lighter than my conversation. The person reviewing our book is Tracy Stewart. She is a board member of Hope Communities, and she has completed a book review of Ezra Jack Keats' Apartment 3. Now, many of us remember, I'm sure, Ezra Jack Keats' book called The Snowy Day. So this Apartment 3 is a book that is later in the series when our main character is a little bit older. Tracy reads from the book, and to be truthful, her rendition really left me wanting more. So even though this is a children's book, I think you'll really enjoy hearing Tracy's review, and you might just want to pick that book up to read it yourself before you give it to a kid. So please watch Tracy's video. We will post it in a little bit. And I certainly hope that you have a wonderful week. I am sorry again for being late. It's Chrome's fault. We've been working diligently to get to you, and I hope you have a great rest of the day. We will see you on Wednesday. Thanks. Bye.